Hello everyone, I am Mala Santan, a second year Mbbs student from DYPMC. Welcome to my channel Medico Mantra. So, in this video, we are going to learn about the topic Introduction to General Pharmacology and Roots of Drug Administration. First one, what is pharmacology? Pharmacology is nothing but the science of drugs. In this, pharmacology is divided into two words, pharmacon and logos. Pharmacon means drug and logos means knowledge. And you will ask, what is a drug? Drug means in French drogue, which means dried herb. It is used for diagnosis, prevention and treatment of a disease. Treatment of a disease. And now pharmacology is mainly divided into 5 groups. The first one is pharmacokinetics, which means what body does to the drug. Then it is mainly A, D, M, E. A for absorption, D for digestion, metabolism, M for, and E for excretion. The second one is pharmacodynamics, which means what drug does to the body. And the third one, pharmacotherapeutics. It is the application of the pharmacological knowledge in clinical application. And the fourth one is clinical pharmacology, which means clinical evaluation of new drug. And the fifth one and the last one is toxicology. It is the study of poisonous effects of drug. These are the main groups of pharmacology. And drug is mainly categorized into two types, prescription drugs and OTC drugs. OTC means over the counter drugs, and prescription drugs are the drugs which are only prescribed by the registered medical practitioner. And OTC drugs are for example like vitamin pills, Digin, etc., which can be found everywhere like in grocery store, etc. The main sources of drugs are, the first one, plants, second one, animals, third one are microbes, fourth one, minerals, and the fifth one are synthetic chemistry, and the sixth one and the last one is biotechnology. For examples of plants are alkaloids, oils, mineral oils, like that. From animals are like hormones like insulin, etc. From microbes it's like penicillium, minerals like ferrous sulfate, and synthetic chemistry we use in our daily life, and biotechnology also we use in daily life to create many medicines. Now we are going into the topic roots of administration. The factors affecting the roots of administration are, the first one, physical and chemical properties of the drug properties, and the second one is site of action of the drug. So site of action we use as a factor because some drugs may act faster in the sublingual, or some drugs may act fast as in intravenous way. The third one is rate of absorption, and the fourth one is first pass metabolism, And the fifth one is accuracy of the drug required. Like in emergencies, we use the fastest way possible to give a drug. And the sixth one is condition of the patient. Like if the patient is unconscious or continuously vomiting, we can't give them oral drugs. So we use intravenous or any other route of administration. So the main routes of administration are, there are mainly two routes, local and systemic. And in systemic there are mainly other two routes, enteral and parenteral. In enteral means through the enteric system, that is through intestine, which goes through the digestive system. The first one in the enteral system is oral, the second one is rectal. In parenteral, the systems are intravenous, subcutaneous, intramuscular, sublingual, transdermal, nasal, and inhalation. Parenteral means other than enteral. At first, we'll discuss about the topic local applications. Local, which means topical. The action is at the site of application. In the local route of administration, the main systems we use is ENT mainly, ear, nose, and throat. In ear we use ear drops, throat, we use ointments for mouth ulcers, etc. And the second one is skin, ointments, creams, and lotions. These are all act at the site of application only. So these are known as the local route of administration. And there are main other drugs like vaginal, there are known as pessaries, and there are urethral, which are known as bogies. These both are known as suppositories. And next we go into the enteral route of administration. Enteral means through the intestines, enteric system. The first one in the enteral route is oral. It is the most common, oldest route of administration. It is more safer, convenient, cheaper, and no need of assistance. The patient can take their own oral drugs. There is no need of assistance, and it is painless and non-invasive. The oral drugs are mainly of different forms. The first one is solid forms like pills, capsules, powders, dispersible tablets. You will ask about that what is difference between dispersible tablets and normal tablets. For example, we take aspirin. It is a normal tablet. If the binding agent is decreased, so it will be more dispersible. The drug is more dispersible. So Disprin is a form of dispersible tablet which is more fastly dispersible, so fast action is seen. And the other forms are liquid forms like syrups, emulsions, and mixture, etc. etc. The main disadvantages of the oral forms are first pass metabolism is present, due to which decrease in bioavailability. What is bioavailability? Bioavailability is nothing but the total drug which reaches the systemic part of the circulation. Like after the first pass metabolism. First pass metabolism occurs in the liver, and second one is slow action. The oral drugs are very slow acting and they cannot be used mainly in emergencies. And the third one is not 100% bioavailability, I have already said. The second one in the internal system is rectal. In this, no first pass metabolism is present because we insert the drugs into the rectum, which passes, which is not passed through the liver. So there is no first pass metabolism. It is mainly used in unconscious. It is mainly used in unconscious or continuously vomiting patient because oral route is not available because he cannot swallow the oral solid form or liquid form, and during continuous vomit also he cannot take the oral form. So we use rectal form. Main example for rectal form of route of administration is enema. It is the most common one. There are mainly two types of enema: evacuation and retention. Enema is nothing but monovalent soap. In evacuation enema, it is used to remove the bowels from the rectum to evacuate the bowels. So, in this, 180 to 300 ml of the soap solution is inserted so that the evacuation occurs. It is mainly used in radiological studies. In retention enema, we use 80 to 120 ml to retain the bowels. Uh, you know, retention enema is mainly used by the drug smugglers. They used to smuggle drugs using the rectum by using retention enema, retain the drugs in their system. And with this, we complete the enteral route of administration. Now we'll start the parenteral. The first one is sublingual. You may ask, sublingual is also a type of oral administration. No, sublingual means below the tongue. We use it is very fast acting way. It directly goes into the circulation. Only we only use lipid soluble drugs in this method, which bypass first pass metabolism. Hence, there is no metabolism of this drug, so small quantities is sufficient for the drug. It is very faster than oral. The main example for this sublingual type of route of administration is GTN, glycerol trinitrates. It is used in angina pectoris. It is mainly used in angina pectoris. It is a small pill which is placed under the tongue, due to which the angina pain, the chest relief is seen. The pain is reduced. Hypotension occurs. And sublingual route is very convenient for this type of patients because overdose is prevented because after 2 minutes we can remove the pill from the sublingual and we can decrease the dosage for the hypertension. So the second one is cutaneous, which also bypasses the liver. The main one is transdermal therapeutic system, TTS, which is nothing but transdermal patches. It is applied like a patch on the skin, which slowly releases the drug into the systemic circulation. The main example for this also is GTN. GTN is also used as a transdermal patches because if the patient is unable to take the drug, sublingual drug, we use maximum in these cases. So it slowly releases the glycerol trinitrates into the systemic circulation, which reduces the angina pectoris. It lasts for mainly 1 to 3 days. The site of application of the transdermal patches is chest, abdomen, upper arm, and lower back and buttock. And there is one more important topic in this. We use transdermal patches mainly on the chest because it gives a psychological support for the patient that if the patch is pasted on the chest, it gives action direct to the chest. Like if you keep the patch on the calf muscle also it works, but the patient will think that who is this doctor placing the patches on my thighs and saying that my heart pain will be relieved. To avoid psychological problems, we place it on the chest. Third one is inhalation. Only volatile liquids or gases are used, and absorption occurs surface of alveoli. Surface of alveoli. It is also faster and mainly used in anesthetics. For example, rotahilar. Rotahilar is nothing but it is same as the inhaler, but we use the small capsule which is placed into the rotahilar, and we rotate the top of the rotahilar, which releases the powder or the drug into the inhaler, which we can inhale the drug. And most of you are familiar with bronchial asthma inhaler. Asthma inhaler. We have seen in many movies. In bronchial asthma inhaler, synchronization is required mostly. So to avoid synchronization in the babies, infants or older people, we use spacer. Spacer is nothing but this one. This is a spacer. We keep the inhaler over here and we press the dosage. So the dose is released into the spacer. So the baby can easily breathe. Like the babies can't synchronize with the inhaler, right? So we use spacer. And the fourth one is nasal type of administration. Nasal we use it mainly in nebulizers. It crosses first pass metabolism and crosses blood-brain barrier also very easily. And the next one is subcutaneous. The subcutaneous is less vascular and richly supplied by neurons. The main drug used for subcutaneous is insulin. The main sites are triceps, anterior thigh, abdomen. For insulin, no medical assistance is required. The patient can do by himself. And the special form of subcutaneous are dermajet, pellet implantation, and the most common one is Norplant. It is a like birth control implant. And the next one is intramuscular IM. The main site for intramuscular is deltoid, triceps, gluteus maximus, brachialis, anterior thigh. So intramuscular is very common. We use vaccines. The anterior thigh is a very special one because we use it only in infants maximum, because infants gluteus maximus are not developed because infants cannot walk, so the gluteus maximus are not developed, so we use intramuscular injections on the anterior thigh. Intramuscular is faster absorption because muscles are more vascular. The next one is the most common one is IV, intravenous. These are slowly infused, fast acting because they're directly entering into the systemic circulation, and it is through the superficial veins that is into the bloodstream. The main advantages of the IV are immediate, in emergency, very faster. Bioavailability is 100% because it does not pass through the first pass metabolism. Accurately measurable, and high irritable drugs are can also be used through this by using dilution. We can dilute the highly irritable drugs and we can use IV to send them. And the main disadvantages are air embolism may occur, and drug particles which we are infused into the IV can cause embolism also, and it is the most risky route. And the last one, intradermal injections. It is directly into the skin like BCG vaccine, and we use intradermal injections like in checking the sensitivity of the patient, like what he is sensitive to and what allergies do the patient have, like he have peanut allergy or cashew nut allergy or etc etc, dust allergy etc etc, and it is directly into the epidermis. And I want to tell you about the advantages of the parenteral route of administration. They are fast acting and can be done in unconscious or uncooperative patients also, and continuously vomiting patients also. The main disadvantages are sterilization is very required in this type of route of administration, and assistance is guaranteed required. Risky, very risky than oral. Now we'll go through the solid dosage forms. The first ones are powder, like ORS, oral rehydration salts. The second one are tablets. There are many forms of tablets. The first one is chewable. These days, because due to corona, we are using many immunity boosters. In that, we use vitamin C. Vitamin C we get as chewable tablets. The second one is dispersible tablets, as I explained earlier. And the third one is sublingual. You already know about those. And the fourth one are enteric coated. Enteric coated are nothing but we use a special coating to prevent the acids in the stomach. The drug we want should be acted in the intestine, so we use enteric coated tablets so that it doesn't dissolve or disperse in the stomach due to the acids. So it can be dispersed only in the intestines. And the next one are sustained release tablets. The sustained release tablets are nothing but if a tablet is coated in different colors. The first coat is black, so this coat dissolves in a period of time and the drug is released inside that. And another coat, like the green coat, is done inside the red coat. This green coat is dissolved after the red drug is released, and another drug inside the green coat is released, and the controlled released tablets. These are also same type, and we use mainly capsules because if the drug is not palatable, taste of the drug is not comfortable for the patient, we use capsules. And there are another type of capsules also. They are known as spansules. Spansules is nothing but you have observed many capsules with different color balls. The different color balls are present because one color ball releases the drug at different intervals of time. Like if the green is released at 1 hour and the blue is released at the 2 hours, the spansules releases the drug at different spans. If you like this video, please like, share and subscribe to my channel Medico Mantra.